Welcome to the Rhode Island Division of Developmental Disabilities Quarterly Community Forum. Tuesday, March 18, 2025. Hosted by Advocates in Action Rhode Island.
I'm Heather Mincy. I'm the Assistant Director of the Division of Developmental Disabilities. Thank you for attending this. We're trying something a little bit different. Our comps team helped us put this all together. So thank you to Johanna and Amethyst. And we'll hear from Advocates in Action. We'll hear from Ripen and the Sherlock Center on the statewide workforce initiative stuff. And then it will come back to the division. We appreciate you all again being here. And we'd like to hear feedback as well on how you thought the presentation went this time. Thank you.
Welcome to the DD Community Forum, March 18th, 2025. Co-hosted by Advocates in Action Rhode Island and the Rhode Island Department of Behavioral Healthcare, Developmental Disabilities and Hospitals, aka BHDDH. Next slide, please. Here are some Zoom tips to get us started. Tip 1. Stay on mute and unmute to ask questions. You can either just click the microphone icon to unmute, or like I'm doing, you can hold down the space bar if you like. Tip 2. It's your choice to turn your video on or off. Join as a panelist to turn your video on. I think that's not a problem this time around because this is a meeting now and not a webinar. So just ignore that. It may help Wi-Fi in some cases to keep your video off. Tip number 3. An ASL interpreter, possibly multiple interpreters, are present at this event. Tip number 4. Not everyone can use the chat, so try not to use the chat. To ask questions, use the Q&A button, or just ask them out loud. Thank you. Next slide, please.
Can I just say before you go to the next slide, Andrew, that we did not have any requests for an interpreter, and that's actually fortunate because our interpreter we had issues with our interpreter. So we will try to put interpreting in the video if anyone needs it there, but we don't have it for here. And I apologize if someone came and they needed it and they didn't get the request and we weren't able to do that. And there is no Q&A button because this is now a meeting instead of a webinar.
Today's forum will share updates from Advocates in Action, the Sherlock Center, the Ripen Self-Directed Support Program, and BHDDH's Division of Developmental Disabilities. And now for our first update from Advocates in Action.
2025 Self-Advocacy Conference, Try Everything, Thursday, May 8th and Friday, May 9th. And for picture description, the images on the slide are of an Advocates in Action logo that says, "Nothing about us without us," and with 3 cartoon people cheering with pom-poms. With, drawn by Kelly Donovan. Hey, that's me. This year's Self-Advocacy Conference is about possibilities and determination. Try everything. Give it your shot. Give it your best shot. Learn from your mistakes and never give up. Try everything. The conference here. Next slide. So here's a Try Everything Conference Day registration form for Thursday, May 8th. The images are the same ANA logo that says "Nothing about us without us," and the 3 people cheering with pom-poms. And there's also a QR code on the slide. Day 1 of the conference, it's from 10 a.m. to 2:30 p.m. It's exclusively on Zoom. There will be general sessions, workshops, music, raffles, and lots of fun. You do not want to miss it. Registration for day 1 of the conference is free, but you must register to attend. To register, you can scan the QR code on the slide by opening your phone camera and holding it up to your QR code. Don't take a picture of it. Just keep your camera on, but don't take a picture. When a link pops up, just click the link to see the registration form. You can also go to www.tinyurl.com/SA Conference 2025 or visit the Advocates in Action website for more information. Next slide.
Just to be, it's SACONF 2025 for the link. It doesn't say conference, just in case anyone's listening.
Is the Try Everything Dinner Dance Party. Friday, May 9th from 6:30 p.m. to 10 p.m. at the Marriott downtown Providence. The images on the slide are of Denise Flynn, also known as DJ D Flizzle, the Marriott logo, a cartoon ballerina, and a party ticket that says $30 per person. There is also a QR code on the slide. The dinner dance party includes a full banquet-style dinner, raffle prizes, and dancing to music from DJ D Flizzle. You can purchase tickets by scanning the QR code on the slide or by going to the www.tinyurl.com/2025 conf dinner dance. You can also visit ANA's website for more info and to purchase tickets. Next slide.
It's just helpful when you do a URL. This is not on you, but when you spell it for people. CONF, because it's so CONF 2025 CONF dinner dance.
All for presenters. We are looking for workshop presentations for day 1 of the conference on Thursday, May 8th. If you would like to present a workshop, submit a presentation proposal and let us know what you'd like to share. Don't wait too long. Proposals are due by Friday, April 18th. If your proposal is accepted, we will send your presentation team 2 free tickets to the dinner dance. To find out more and fill out a proposal form, you can scan the QR code on the screen or go to www.tinyurl.com/25CONFPRESENTER. And of course, you can go to Advocates in Action's websites for all the details. And as a picture we are looking at the images on the slide are a bullhorn with words coming out of it that say information is power, a cartoon person holding up a bullhorn and saying speak up. There's also a QR code on the slide. Next slide. Stay in the know. Get on our email list. The image on the slide is the Advocates in Action logo. When something is happening or we have news to share, we send out an email to everyone on our email list. You can join the mailing list by visiting our website at advocationorg/contact. Fill out your name and email address and you'll get all the latest news from us.
Are we stopping in between, you guys? Yes, okay. Yay, Kevin!
Great job, Kelly.
The slides, you guys, we're gonna have any materials that people want to talk about or share. We're gonna put them on the ANA hosted page with the conference recordings and all of the slides you see and all the notes and all the little URLs that Kelly was reading. They'll all be there. So if you're not taking notes, if you're not able to take notes, or you don't want to, you don't have to.
So I have a question, Deb. I just wanted to know, this is Heather Mincy from BHDDH. Are there opportunities for people who can't afford to attend? Do you have any, like, I don't know if I'd call it a scholarship, but any, ways for them to attend? Does anybody
Yeah, so that
donate them?
Yeah, the dinner dance costs us about $90 a person because of the space, and the Marriott is buku bucks, and we charge $30. So we people that are in our leadership class, if anybody wants to take it next year, we give them a discount. If you didn't know that class, now you do. Yay! And then if you want to be a presenter, and if you really don't have any money, then send us a message, and maybe we know somebody like my husband who'll pay for it. So, you know.
Yeah, well, that's good information to know too, that others who may want to sponsor someone else.
Yeah,
there may
and
be
there is a space,
opportunities
there
to
is a
do
place
that.
on the forum, right, Michelle? Isn't there a place for people to donate?
Yeah, actually,
Oh,
on
there
the
is? Okay.
ticket form, you can make a donation and that will go towards to defer the cost if somebody
Defer.
can't
Okay.
afford it. Yeah, because we definitely want people to be there. We don't want that to stop you.
We have never had anybody not be able to come because they couldn't afford it, because we will find a way.
We will
We'll
always
take
find
it
a
out in
way.
sweat equity. No,
No,
that means
that
you'd
is
have to
not
work
true.
for us. To get it.
Nope.
Well, you come and help. You can help clean up the tables or something. No,
I don't know.
don't worry.
And
Let us
also, I
know.
just
There's
also
nothing wrong with the little hard work.
also I just want to let you know there's a workshop contest. If the best workshop is the best, you'll win free tickets.
Actually, it's just if it's accepted. It's not even if it's the best. We have room for 8 sessions.
8
So
sessions.
yeah, and so 2 people from each session, so 16 free tickets out there. And if you have, you know, we're very generous. Okay, we have ways of making it happen. So
Yeah,
don't let that get
that's
in your
what I
way.
meant to say.
Yeah. Thank you, Michael. Should we go on? Should we put it back up?
Okay, now can everybody see the screen again?
Yes.
Yes.
Thanks, Michael.
Great, the slides are set. Go ahead.
It's now time for the Sherlock Center Rhode Island statewide workforce initiative update.
So hi, everybody. Thanks for having me come and give this important update. For those of you who may not have met me, I'm Amy Grattan. I'm the Executive Director here at the Sherlock Center. And I'm here to talk about our work with the Rhode Island statewide workforce initiative. So just to begin, know that this work is what's called statewide work. And that means that it's something that's being looked at across the state. So there are partners who are involved in this work that are not just people from Sherlock Center, but from the other state agencies, individuals with IDD, provider organizations, parents, families, and direct support professionals themselves. When we talk about the workforce, we're talking about all the people who work in a certain job or field. And the word initiative speaks to a special plan or project that works to make something better. So the goal of the Rhode Island statewide workforce initiative is to make it easier for employers to find and keep direct support professionals or DSPs. And we know that DSPs play a key role in providing quality care for adults with intellectual and developmental disabilities. And the RISWI initiative was created to improve support for Rhode Islanders with IDD by focusing on the challenges of the shortage of DSPs and to make sure that they have the training they need to do their jobs well. And when we talk about employers, we're talking about people who self-direct, who might be hiring DSPs to work with them. But we're also talking about providers who hire DSPs that support individuals with IDD as well. So we're talking about really looking at everybody as an employer. And so you can, on the slide, it says that RISWI helps make it easier for people to find, hire, train, and keep direct support professionals. So again, that's the goal of this work. And the way that this work happens is that there are groups, and in this case, we have a couple of different groups that come together to talk about different topic areas that support the decision-making and help provide information and resources in order to help employers make it easier for people to find, hire, train, and keep DSPs. So I'm going to tell you a little bit about the 5 primary work groups that we have. And the first one is, it's called Data and Reporting. And in that group, they're looking at and talking about collecting information and ways to use that information in order to make better decisions. The second group is about marketing and recruitment. And marketing and recruiting is about helping people learn about jobs and finding the right people to fill those jobs. The third group is policy guidance and worker voice. And in this group, they're talking about creating rules and ideas to make jobs better for workers and listening to what workers say about their experiences. The fourth group is the selection and retention group. And that means selection and retention means choosing the right workers for the job and finding ways to help them stay in their jobs longer. And then finally, the last group is the training and professional development group. And that means that they're looking at helping workers to learn new skills and improve their jobs so that they can provide better support. So those are the 5 working groups that happen every month. In addition to that, we also have an advisory group that is made up of a variety of people who provide information and feedback related to the work that's happening in the 5 work groups. And then we also have one last group that's called the Coordinating Council. And the Coordinating Council oversees all of the work that's happening. In each one of these groups, they have a plan. And so the Coordinating Council makes sure that everybody's on track and that they're working on activities that support their plan. Next slide, please. A couple other things I just want to also mention. That the groups do get support from the University of Minnesota's Institute on Community Integration and the Rhode Island College Sherlock Center. So we also help to make sure that the groups are continuing their activities aimed at supporting employers to have the information they need to make decisions about their hiring and their training of DSPs. So in February, we had our 2025 annual summit, and that was a day in which all of the people participating in the work groups had the opportunity to come together, and they shared updates about the work that they have been doing in the past year, and the community had a chance to give and share feedback. So a total of 74 people joined the meeting. Some were online and some were in person. Everybody who attended the meeting felt that their opinions were heard and appreciated. And they also had the opportunity to learn more about the work that was being done. So it was a very successful day. Updates were shared and the community had the chance to share feedback. 74 people went to the event. People included people who get support, direct support professionals, supervisors, provider organizations, BHDDH staff. And the last bullet just shares that people like the event, sharing they learned a lot and could openly share their feedback. All right, if you want to learn more about the initiative, you can email us at riswi@ric.edu or visit the direct support workforce webpage, which is www.riswi.org. And it is available and has resources to help find, train, and keep direct support professionals. One example of something you would find on the webpage, there is a realistic job preview video that shows potential DSPs, what the job is really like. These resources were made possible thanks to the dedication of the work groups. So that's all I have.
I have the link that you just mentioned. When you put your mouse over it, the second one, it shows a different one. It shows something on Sherlock. So is it Because these slides are going up, so it said something about Sherlock's.
You should be able to get it with the www.riswi.org. So if you type that
Okay.
in, it'll take you
Okay,
to that page.
all right, so don't be confused, we'll check that one.
Don't be
Okay.
confused by
All
that.
right. Olivia's hand is up.
Okay, I have a quick, I didn't know if I was supposed to talk or if I was supposed to not talk, because I'm also in the AIA group. And I know that we're not supposed to blurt, so I didn't want to blurt. Amy, I did have a question for you. So the links to all of these groups, are we gonna be able to access them? Or
The information that's being presented in the work that's happening, like the minutes or things like that?
yeah. Are we gonna be like this presentation, are we gonna be able to access it afterwards, I guess?
So this presentation, yes, you'll be able to access it. Deb will know how to do that.
You will
She'll
be able
send
to go
that
to
link.
advocatesinaction.org, and there's a thing on the side that says community forums, and everyone who signed up here, we're gonna send you a message, right, Michelle? You send an email saying the recording is at this address, and the division will have it on a link to it on their site. We'll definitely get it to you. Plus, Olivia, you get extra points because you're in the class. We can send it to you there. And then last time, Amy, people had a lot of reports and stuff they were sharing in the chat and here and there, and so anything like that, we will put those all on the page too. And they're all already there. The last forum 3 months ago, it was in December, the last forum. Oh wow, time is like a blur. The last forum, there was a lot of information shared, and it is all on the website page, on the community forums page, on Advocates Action / DD Community Forums, I think is the link.
And if there's ever something you have specific question, you can always reach out to myself or Kim Einloff, who's not here, or Kelsey Collins, or anybody at Sherlock. We're more than happy to answer any questions that you have.
Are you looking for other people for your work groups, Amy, or have they already been going on for a while?
Well, I'm going to defer that one to Kelsey. Kelsey, are we still looking for people, or Megan?
Yeah, this is Kelsey. We are always accepting new people into any of the work groups. So yeah, like Amy said, if anyone is interested, you can email that riswi@ric.edu, and we can get you pointed in the right direction.
Thanks, Kelsey.
We're going to go through this, and then at the end, you're going to have, if you have other questions you came with, like I know we talked with people in our leadership class, in our graduate academy, there's a lot of people here, yay, and we said, if you have questions, this is going to be the place to ask them about the DD system. So there'll be time. Doesn't have to be about this stuff, but there's a couple of slides coming up first. So next, yes, put it back up. All right.
All right, now we have updates from RIPEN's self-directed support program, given by Susan J. Donovan, the Senior Program Director.
Thank you, Andrew. Hi, my name is Sue Donovan. I am a white woman with short, dark, medium brown hair. I have black headphones on today, and my background is a dark green with white letters on the top that say RIPEN, R-I-P-I-N, and are a white logo, which is a compass. We really like compasses at RIPEN. So the first slide you see here is our current calendar of events. We have a QR code on it that you can use to bring you right to the self-directed support program. And it's our lineup of events from January until June. It's on our registration page on our website, and there's a link to sign up for all of them. Since the next one is coming up on March 25th, we will be having a live panel, and we are bringing in the Division of Developmental Disabilities, DDD, the communications team, and we're going to hear from them about the work they've been doing and how they've been able to help consumers and families with accessing information and resources. In April, we have a hybrid event on a Saturday, April 26th, and in person we'll be at RIPEN at 300 Jefferson Boulevard in Warwick, and there'll be some good snacks, and that'll be at like 10 in the morning. And we are also going to have some folks online on Zoom, and we'll be sharing a self-directed toolkit. Ripen has been busy putting together different handouts and sheets and templates, things that you can use that will help you track hours and do planning when you're doing self-directed, planning your days, planning your nights, planning your weekends. So we're really excited to have that event on April 26th. And then May is Mental Health Month. So we've got a great panel that we're bringing together to talk about mental health and mental health supports that we can tap into, and how to access mental health supports, when to access them. And so we're really excited about that. And that's a live webinar. And what we do with our live webinars is, it's like this, right? We're on the screen like this in real time, but we record it. So that way, if like you couldn't make it, then you get the recording link from us. And we also put it on our website so that it can live forever and ever. And then Sharon and her team are super busy right now trying to plan a super fun in-person event that will probably be in June, where we can come together. If some of you joined us, I know back in February, and we did a self-direction connection, and we did a lot of brainstorming and talking about what we would like to do when the weather gets better and how we'd like to come together and kind of share good ideas and meet each other, right? Make new friends, especially friends that have similar or common interests that we all have. So Sharon and the team is working, hard at identifying a really good place that we'll be able to come together and have some food, maybe some music, some laughs, and fun things to do. So check that out. This is just a QR code. And again, reminding, visit our self-directed support programs webinar library on the Ripen website. And all of the recorded webinars are there. Popular topics, right? One of the most popular topics that we see, they get a lot of views, people go on and watch, our employment supports. Also, what is self-direction? A lot of folks all over are checking that out on the website. ISPs, or individual support plan, right? What is it? How do I participate in it? How do I write up this plan? Who helps me? And lots of other great topics to help navigate and utilize self-directed services in Rhode Island. So at Ripen, we've been embarking on a calling campaign, and we've been doing this for a while now. So it's good old fashioned phone, right? And so our team has been, we've actually hit over 1,000 outreach calls, and we are outreaching to folks like you that are using self-directed services. And we've had a great time, a great opportunity to get feedback from folks, to hear what they're doing, some of the things that they're doing, some of the creative things that they're doing, and some of the challenges that they're having. And so we've been able to connect them with different resources and connect them to different people, just to help them build their plans and build their meaningful lives. So that's been a lot of fun, and we've met a lot of people by phone. On the next slide, we'll talk a little bit more about what they shared. So we were able to update contact information like mailing addresses and email addresses for 547 consumers. There were 310 folks who didn't want to be found, so we kind of lost contact with them. We have 10 people right now that promised to call us back, so we're hoping to hear back from them this week. And then we had, aside from our calling campaign, we had 109 individuals who have been coming to our workshops, coming to our webinars, and they just reached out, picked up the phone, and they called us first. And, looking for some help, looking for resources, looking for referrals. So I know, I see someone in the crowd here, Megan from University of Minnesota. You know, we have a lot of friends. Rhode Island has a lot of friends in Minnesota, especially the University of Minnesota. And they are responsible for a wonderful newsletter called a project called Institute on Community Integration. So on this slide, it says, have you seen the articles? And there's a couple of pictures. One picture is of a printed copy of Impact, which is their newsletter, which is really awesome. It comes out 4 times a year. And then on the right-hand side of the slide is a very dapper picture of our A&A folks. I see Keith and Kelly and Andrew, and they're at the Advocates in Action table. That was at the November 8th Self-Directed Support Conference in Rhode Island at the Crowne Plaza. And on the bottom of the slide is a tiny URL.com/4 V as in Victor, P as in pancake, AXPH4. And when you click on that link, it actually brings you to the newsletter called Impact. And there are a couple of awesome articles in there. One is about self-directed services and what we're doing in Rhode Island. And then the other one is about our friend, Andrew Whalen, who happens to be with us today, and his his lived experience. So if you have a chance, check out those articles. They're worth the time. Okay, so this is just our contact information over at Ripon. You can call us 401-270-0101. Our phones, we have live answer Monday through Friday from 8 a.m. to 5 p.m. Our self-directed support team has an email address, self-directed-support@ripon.org, O-R-G. And, you know, you can send an inquiry. We also have our website, ripon.org, and our Facebook and our Twitter and Instagram account, so you can follow us if you'd like on that. But definitely start with the website page, because there's a lot of good stuff on that website page. That's all I have for you today. Any questions?
I am biased, but I highly recommend the article by Andrew. He's an excellent writer. I am biased, but I'm serious. I mean, even if I wasn't, he's a really good writer. And he's ours!
The articles are very well written, and you definitely will enjoy it. Well, thank you so much.
So the
Yes.
events you have that you put there with the calendar, a lot of those are on Zoom, right?
Yes.
So people can
yes.
sign up for those, and that calendar that you put there,
Absolutely.
that'll be on our website. And also, if you just go to Ripon, you'll find it right there. If you can't remember the self-direct part, you can go to Ripon
Right.
and you can type.
Just go to the Ripon website, right, and you can get to the self-directed page.
They have lots of good stuff.
Yeah, and I know that the Ripon team, we all plan on going to the ANA conference and also going to the dinner dance. We wouldn't miss it for the world. And yes, so we're getting our dance shoes ready.
Yeah.
Thank you so much.
Sue will save you a dance. Yeah. Any questions for Ripon? Anybody? Anyone? Those are free events, even the one with the food, Sue? Does it cost any money?
Free. If it's free, it's for me, Deb.
Yeah,
if it's free, it's for me. Yeah.
Nice.
You come, you eat. Yeah, we like to feed you.
Do people have to self-direct to go to it?
Most of the people are, but maybe if you're like thinking about self-direction, you know, it's like stop by.
Yeah. And even if you just want to learn about it, if you're already using services from an agency,
absolutely. Or maybe, right, you could be a professional working in the field, like absolutely.
Yeah.
We've got, we welcome, you know, it's our consumers and their allies, right?
Yeah.
So anyone working in this field, we welcome to come to our webinars and our events.
And one thing that, just to put a little bug in people's ears that we have learned and people told us about, we have a class for people who self-direct to become peer mentors. And one thing that people told us that they learned, and I think that one person said they learned this at the conference, was that if you're using an agency and you're fine with a bunch of the stuff you're getting, but there's this one thing you really want to do and you can't, you can split. You can self-direct some of your services and you can use an agency for the other stuff, and that's fine. So if you're thinking of that and you're just want to know, and it doesn't hurt to go and find out. There's nothing, it doesn't cost you anything.
That's a good point, Deb, and a lot of people aren't aware of that, and we call that hybrid services. And so there's so much more you can do today. So we really encourage you to get out and come connect with these groups so that the more you learn, right? Well, thank you.
Right. And now we hear from the Division of Developmental Disabilities at BHDDH.
Thank you, Andrew. This is Heather Mincy, and like I said at the start, this is something new. So I realized I forgot to do one thing, which is introduce myself visually too. So I am a woman with curly hair. Thanks, Sue, because Sue Donovan just reminded me of that as she started her presentation. So case managers and independent facilitators, that is what I am going to start talking about. And on my slide, there is an image, and it is of two people sitting side by side. They are smiling. There's a stack of papers in front of them and a computer screen behind them. So case managers and independent facilitators are two new types of provider supports that you can get. They will help you to lead your person-centered planning meeting. So lead your, and we have on the slide PCP because that's an abbreviation for person-centered planning. They will help you to write your PCP, so your person-centered plan, and make changes to it throughout the year if you need to. They will help you to learn about resources in your community, services in your community, and supports in your community. They will help you explore new opportunities and activities. They can help you get resources, services, and supports in your community, and also help make sure you are happy with the services that you are currently getting.
Can I just ask how the person-centered plan is, that's individualized support plan too? Is that the ISP or is that something different?
Yes, so that's your plan that they do within your service planning meetings. But yes, people might also call that your ISP, which is your individual service plan, or you may hear people refer to it sometimes just as a service plan.
Heather, there's a question in the chat. Trying to see if I can get to it here. Here we go. Someone wanted to know, when will facilitators be assigned, or will they be assigned?
We have already started assigning independent facilitators, who we refer to as IFs, abbreviation for them. They have started working with people as of September. We started assigning some people to them. And it's a continuous basis that we continue to assign new people coming into the system to an independent facilitator, and also individuals who are in our system transferring people who are in the self-direct program and working with a plan writer to an independent facilitator as we build capacity. So as the people who are doing the independent facilitation work have space, I'll say, on their caseload to take on new people, we're assigning new people. So it's on an ongoing and continuous basis.
There's another question in the chat from the same person, and it says, I have an ISP coming up for July 1st renewal. Will I get one, or do I have to hire a new plan writer? We self-direct.
For some people, you will continue to work with your current plan writer. There are some people who we are assigning to an IF. We would let you know. We'd reach out to your state social caseworker, and the person who would be working with you, the current IF. We would have that person be reaching out to you as well.
Yeah, the same person is also saying the old plan writer is not available.
So if your old plan writer is not available and you self-direct, we have been working with the fiscal intermediaries, the FIs, that's what we call them, abbreviation, the FIs, to find out who the plan writers are who are not continuing, and they are giving us people's names. And so we are trying to assign those people who don't have a plan writer to an independent facilitator.
Do you also see Kathy's hand?
Yeah, Kathy, what did you want to ask? And I think you go ahead.
Would I still have the same plan writer or would that change?
Good question, Kathy. It depends on if your plan writer is choosing to become an independent facilitator. So there are plan writers who have chosen to become and have gone through the training to become an independent facilitator, but some plan writers either haven't done that yet, or there are some plan writers who have just decided they don't want to do that. So that is up to them. But at some point in time, if your plan writer chooses not to become an independent facilitator, you would have to move to either an independent facilitator or a conflict-free case manager to support you during your planning process. I should say that too. Does that answer your question, Kathy?
I think so. Case manager, that's not social worker, right?
Nope, that's not the social worker. That's a good follow-up question. So there are case managers, what we call the conflict-free case managers. There are private ones who work for certified conflict-free case management agencies. And then there are also state case managers who are doing the plan writing work now too. So you
Okay,
could,
so
yes,
sorry.
so there's different people who could be doing this case management work. But for your purposes, I would say if your plan writer does not become an independent facilitator, you will need to move to someone who can support you, who's seen as a case manager by the state or an independent facilitator.
Okay, I'll ask her.
Okay.
So do I just ask, what do I ask?
So I would say you should talk to your plan writer and ask them, do they plan to become an independent facilitator, or are they still thinking about it? I will say we won't be transitioning everyone right away to conflict-free case management or an independent facilitator. So your plan writer may still continue to write your plan depending on when it's due. But at some point in the future, if they don't become an independent facilitator, they will not be able to help you through your planning process as your plan writer. I should say that because they could still be a part of it, but not as your plan writer.
Yeah, I think, Heather, that's a really good point because people have been have some concern about that. It's still your plan. So if you
It
get
is. And
assign somebody,
yep, you can have who you want at your planning meeting to be part of that planning process. But the person who is helping you to write the plan, the person who's putting in referrals for you and helping you with your budget and that kind of stuff would be the independent facilitator if you are self-directing, and or a conflict-free case manager if you're, getting agency-based services.
and Heather, if they work with somebody and they don't gel with that person, can they change
Yes,
yeah.
absolutely. Yes.
So case manager and independent facilitator, is that the same thing?
They do mainly the same work. So can I ask that we pull up our next two
Yep.
slides, because
Yeah.
that might answer some of your questions, Kathy.
Heather, will people they'll still have their DD social worker? Is that what you mean, Kathy? The person who
Yeah.
your DD social worker?
Yeah.
DD caseworker, whatever they're called? Okay.
I will go through these next, let me just say this. I will go through the next two slides and then I will come back to your question, Kathy, so I can answer that for you, okay? And answer
Okay.
other questions. Okay, so the next slide is case managers and independent facilitators. How are they different? So case managers work for agencies that are certified by Medicaid, and they help people who go to an agency. They can help to get services. They help people who self-direct, or they help people to do a combination of both. So agency-based or self-directed. And we call that, we have in parentheses, it's called a hybrid. That's kind of what Deb was just talking about at the end of our last section, the hybrid model. Independent facilitators do not work for certified case management agencies. They are independent people, like the independent plan writers that people who self-directed had previously. But now they've become independent facilitators, but they still work independently. They only work with people who self-direct. Or they can also, I should add, work with people who are doing a combination of services. So people who are doing hybrid models. The independent facilitators may also work with people in that service model. So timeline. There are, as I stated, when someone asked the question, the conflict-free case management services and IF supports started in September of 2024, so this past September. There are 4 conflict-free case management agencies that started taking referrals for individuals in the adult DD system. And we have to date, so as of today, there's 1,211 participants who have started getting conflict-free case management or IF supports. You can learn more in the consent decree quarterly report for December of 2024. That report is up on our website. And I think that you will get this PowerPoint. So if you click on that link, it will bring you to that quarterly report, which has more information in it. And so to go back to Kathy's point, her question about the state social caseworker, as people get referred to and start working with, and that's an important piece too. So not only referred to, but when you start working with a conflict-free case manager or an independent facilitator, then at that point, you will no longer have a state social caseworker. But it's not until you start working with that conflict-free case manager or independent facilitator. And that is because we want to make sure that people have had a proper introduction to the person who is going to be supporting them moving forward through their planning process. So does that answer your question, Kathy? Or do you have any other questions now that I've said that?
That was a lot.
It is, I know, it's a lot of information. And I will say, we are working hard to try to break this information down into a way that everybody can understand it and communicate it out to everybody in a manner that everybody can understand it. We've really been trying to work with our communications team and also meeting with a few providers, some families of individuals who have started getting either independent facilitation, the IF service, or conflict-free case management services, and some other stakeholders on that group, on this particular group, to see, how we can just communicate our message better to people about what the changes are that are happening with, the implementation of conflict-free case management. So this new support that we're going to have for everybody in our system, making sure we communicate it in the best way. And there are many changes with it. And there's a lot of information to understand.
So, and Heather, if people have questions, they can still call the division, right? The main line for the division, or they could use the Ask DD email. Like, you're still going to be there.
Yes, we
Yeah.
will still be here. We're not going anywhere. At least I don't think we are. No, we're not
Fingers
going
in, they're going
anywhere.
anywhere,
We
yeah.
will still be here to answer questions, provide support to you. But there are some individuals who will no longer be assigned to their, state social caseworker that they've had when they start working with a conflict-free case manager or an independent facilitator.
What's
Do
an
those
email?
people? You have her email?
I'm just asking what's an email I can send.
So, well, it's in one of their slides, they have it. They have their contact information coming up. But
Email the division at bhddh.askdd@bhddh.ri.gov.
are those caseloads smaller, Heather? The now than the DD? I mean, it couldn't be any bigger than the DD case workers have. So, will that mean more access to somebody?
Conflict-free case managers and independent facilitators. There is no set, like it has to be this amount of people that you work with, but the state has given guidance on it being around 48 individuals per person who's providing this service. So it will be a lot smaller, group of people that the conflict-free case managers and the independent facilitators are working with, especially compared to the state social caseworkers who did have caseloads that could be, close to 200 people. So very different.
So that's a plus then, if you're,
That is,
I
yes,
love
it's
that
a
you said
big
that's a lot,
benefit.
Kathy, because it is. People are really confused by it, but little baby steps, one at a time. But the best thing to know, well, one of them is that when you land and you have the person, you're going to be able to reach them more easily. Like right now, sometimes because the DD caseworkers have really big caseloads, but you could find somebody that you could reach faster than that. You have more access to them. Does that make sense?
Yes.
Yeah, I think.
Andrew, there's a couple more questions in the chat, Heather, if we can look at those before the.
Okay.
We got one who's apparently been making questions all along. This particular one says, my FI told me BHDDH told them they are not allowed to give plan writer lists anymore. Is that true?
So yes, we have worked with the FIs and we have told them not to send out the plan writer list because we need to assign all new and incoming people to the fiscal intermediaries to either an independent facilitator or a conflict-free case manager.
What is the difference between the case managers and the independent facilitators?
So all good questions. So I did go over, but I'll just briefly restate. The conflict-free case managers work for agencies that the state has certified. And the independent facilitators are individuals who are doing this work independently and do not work for those conflict-free case management agencies. That's the main difference. And the conflict-free case managers also work with pretty much everyone in our system. They can work with people who are self-directing, those who are getting agency services, or those who are getting a combination of agency and self-directed services. The independent facilitators are working with people who self-direct or people who self-direct and get agency-based services.
Also, what is the support brokerage in the role that they have with self-direction in comparison to that case manager or facilitator?
And for the support brokers' role is different because the support brokers are individuals who help people more on like the day-to-day implementation of your plan. So say there's certain goals that you have in your plan that you want to accomplish, and there's different steps to those goals. Aside from your working with your DSPs daily, so your direct support professionals daily, you would work with your support broker. Maybe if you needed to hire staff, you could talk to your support broker about that. If you needed, to do some community mapping to find out exactly what's in your community and getting connected to that, your support broker could help you do things like that. They may help you if you wanted your staff to go through training and helping you figure out what might be good trainings for your staff, those types of things. Where the conflict-free case manager or the independent facilitator is really going to meet with you once a year during your planning process, bringing all of your team members together to talk about what goals you have for the upcoming year, what went well last year, what things you want to do this year. They will also do check-ins with you throughout that year. They could be monthly, it could be every other month, to see how you're doing and to make sure that all of the things that you have identified that you want in your plan, that those things are being worked on, so that you are meeting with your support broker if you have one, that your DSP is providing you the support that you need on a day-to-day basis. That if you're working with a provider agency, that provider is giving you the supports that you need, want, and asked for in your service plan.
We have another question that asks, are fiscal intermediaries allowed to give out plan writer lists anymore if we aren't assigned an independent facilitator?
So we have asked the fiscal intermediaries, the FIs, not to give out those plan lists. So they give us names of individuals who need to be referred to an FI, and the state is making those referrals and then letting the FIs know that, the fiscal intermediaries, and then connecting the individual's state social caseworker to the independent facilitator so that they can reach out to whoever the person is and do an introduction.
I think that you, some of the questions in the chat sound the same, but the one there, the formal transition, is that clear? Did they answer your question?
So, yeah, I'm a little confused. If somebody is already working with the plan writer who has already done the training and intends to become an independent facilitator, or is already, how does that transition from having a social caseworker assigned or having them disappear and not be assigned? How does that happen formally, or just?
It is happening formally. I'll say kind of behind the scenes with the state and the plan writer or independent facilitator at this point. So if somebody is going through training or has already gone through training and was a previous plan writer who has a caseload of individuals that they have been working with, we are asking them for that information. Depending on how large somebody's caseload is, we have to work some of that out with some of the plan writers, because some plan writers are working with a lot of individuals and they can't continue to work with as many individuals as they have been supporting.
Okay.
So not everybody, not all, but there are some, and we are working with those people. And we're working with the other people who can just transition their caseload to now supporting them through this new process. But we want to be mindful of the fact that there is more work that needs to be done with individuals in this new process and not overload the independent facilitators too. So we're trying to balance things out.
Sure, but from the participants' point of view, will they know when that shift is happening? Because otherwise.
Yes, they will. So we work with the independent facilitator and we're working with the person's state social caseworker. So whenever that change happens, there's an email between the independent facilitator who's going to be assigned, whether it's a new referral or it's somebody that, an independent facilitator has already been working with on their plan writing caseload. The state social caseworker, because there would still be a state social caseworker involved until the IF is engaged with the individual in this new role. And then also the fiscal intermediary too is on that email, so that everybody is in the loop and knows that
Okay,
this is happening. Yes.
I just, for the sake of time, I think
I
those are
know.
all the questions about that, but, can you guys just, when you send out those letters, can you send a picture of the new person that's gonna be in that person's life if they don't know them? Please.
For
Ask them
the, are
to.
you asking for
I'm
the?
saying, yeah, when I get a letter that says, here's your new person, I would love to see a picture of them. If I don't, especially if I don't read.
That would
So
be
I will
good.
say, I guess we can talk about that. The one thing
Yeah.
I will say is in the other group that we're working with stakeholders to talk about better ways to communicate all information related to conflict-free case management. One of the things we talked about and somebody requested was, could they have badges so that people could, you know, be identified that way? But yes, we can talk about that. That's a good suggestion too.
Yeah,
I
that
know
would
we
be
have
good.
more. Oops, sorry, Kathy.
No, I'm just agreeing with that. I like that.
You like that idea? Yeah. Okay. Definitely talk about that. So I know there's other slides after this, but I'm going to turn it over to the communications team who's going to finish it out, either Amethyst or Johanna. Thank you.
Thank you, Heather. It's me, Johanna Mercado. You can call me Joe. Just to give you kind of a visual, I am tan, with wearing a black shirt and dark brown hair. It's a little messy, so don't pay attention to it. So on the screen, we have a DD guidebook. It's just the front cover of our new guidebook. The division created definitely essentially a DD guidebook. The purpose of this is to share information about the developmental disability service system and options. The guidebook includes information about how to apply for services, how to pay for services, what a person-centered plan is, otherwise known as PCP. It is why and why it matters, what the different services are and how to get them, tips to stay healthy and safe in the community. It's a wonderful opportunity for you to kind of dive into it. It's in plain language, and we definitely try to do accessibility when we're talking about the content. Like Heather mentioned before, we're working hard to make sure that all the information that we put out there meets the standards of the intellectual developmental disability community that we serve. Next slide, please. Hello?
Do you not see the next slide?
I don't. I always see. Okay, there it is. Sorry. Your life, your rights. I also want to apologize. I have terrible connectivity issues, so I apologize for that. Your life, your rights is a really cool and wonderful opportunity. We're very excited to launch this new program where basically the division is going to expand on the campaign that we did last year. You may have noticed flyers in the newsletter. And it's basically a new program we're going to launch in April 22nd of this year to May 20th. Well, we'll be running a free weekly trainings on the rights campaign, and we share with everyone that we shared with everyone last year. So there's a sign up opportunity. Just use the QR code that you see on the screen, and you can sign up. If you'd like to present with us, feel free to sign up or reach out to us, and we'd be happy to co-present with you as well. Yeah, that's pretty much it for that one. The next slide, please. Website updates. We're working very hard to make sure that the website makes sense and that it's easy to understand. And so one of the cool things that we did recently is update the assessment page. It features a new process, and we also did a feature on the new community events in a table format on the website. So we're excited to see if this works. We'd love to hear your feedback. If something doesn't work, please let us know. And to access those new features on the website, you just have to go to the QR code that's on the screen. And I think that's all we got. Quick and easy. Does anyone have any questions on the 3 things that comms just launched?
Can somebody, this is the contact information. This will be on the,
gotcha.
This will be on the website too, so.
Yes, contact us. What you see on the screen is just basically main phone number. It's in English. Spanish phone number is 401-462-3014. The main number is 401-462-3421. The TDD line is 401-462-3226. Our address is 6 Harrington Road in Cranston, Rhode Island, 02920. And our email address, if for anybody who wants to ask any kind of questions, not just specifically to communications, is bhdDH.ASKDD@bhdDH.ri.gov. It's a lot of letters, but it'd also be listed on, to answer Olivia's question early on, we'll be posting this as well. You'll see the recording and you'll also be able to access the information in print form, so.
Go, Kath.
That's all we have?
Go, Kath. Kathy's had her hand up.
Oh, go. Yep, sorry. I can't see it.
Is there a link in place of the QR code? Or do you have to use
We'll
the
put them
QR
on the
code?
we'll put them on the website.
Okay.
Yes.
Yep.
Yeah. That's a good question because some people don't use the thing.
The phones, yeah. Anything else? We'd love to hear feedback on the stuff that we have put out if it works. I love that idea about maybe putting a person's face on your letter. We'll definitely see if that works and we can work on that as well. But no one else? I feel like Ferris Bueller. Maybe I'm dating myself on that one, but okay, cool. Well, I'm glad that we were able to do this today. If you have any other questions.
Does anybody need help signing up for the conference? Because we can help you. Come to the conference, it'll be fun. Sue Donovan will dance with you. Right? Where'd she go? Did she leave? Chicken.
I am planning on it. I need to talk to my supervisor things.
About the conference. Yeah, that's totally anybody's thing. Whatever your thing is, we got it. We do record it in all of the sessions, and so you'll be able to see them afterwards.
Hey, Deb.
You know. Hey, Mark?
Matt.
Matt, where? Oh, hi, Matt.
Hey.
Matt will give everybody rides to the conference he did last year. No.
So I'm thinking about doing both this year.
Good.
So I got one question pertaining to the dinner dance.
Yeah.
Are there going to be any tickets at the door?
We don't usually have tickets at the door because we have to order the meals ahead of time. We actually have to give the meals to the hotel on Tuesday for the thing on Friday. So we don't usually have a lot of them available then. But how soon would you know? Because you don't know about your work schedule.
Yeah.
So the best thing that we tell people is if you really want to go, put it in at your boss now and say, listen, this is what this is important to me and this is what I want to do. And especially not just your boss, but the thing that we've also learned is if you want to go and for some reason your staff, your agency is like, oh, we don't have staff, then you tell them, no, I want to go. And let's figure out a way that we can get staff because you're paying the staff. Okay. It's your life. And so don't just take that for an answer. And I know, but I'm very strong about that people have been told, oh, we're short staffed. I'm like, well, let's figure out a way to get you there then. They can help figure out a way to get you there if you want to go. Matt, even honestly, Matt came to somebody's rescue last year. He drove somebody there. So that's why I was saying that. Yeah.
I just wanted to apologize for my connection issues, but I'm back. Hopefully all the information that we wanted to share was good. Thank you.
Any other questions about any of that or anything else you can ask about any kind of thing? There's Alex has a question.
I don't know if this is really relevant, but it's a question kind of about the dinner dance. Is that okay? It's sort of like, if you're going to have, if I were to like get more than one person to come, like sort of buy multiple tickets for like multiple people, who can kind of come and who can't? Are there certain parameters?
Anyone with a pulse.
Anyone.
Anyone with a pulse is welcome. We want it. It's supposed to be a community event. Last year, 2 years ago.
Is that Alex?
Just Keith. We had people. I don't know where.
Is that you, Matt?
Keith invited people from.
Hey, man. Matt came to my rescue last year.
Yes, he's the one who drove. Yeah, that was really cool. Now Alex is in our leadership class. But 2 years ago, there was this group of teachers from New Hampshire that were just at some other event at the hotel, and Keith, our president, he invited them all into the dinner dance. It was so cool, and they were like, oh my gosh, all these people with disabilities just out here. Yeah, just like you. Look at that. It was a very good awareness raising, and we're just all people having fun. So no dead people, Alex, but anybody else is welcome. And then they've only recently died, me.
Yeah, Matt.
The same thing happened.
Cool.
That was after dinner. So that's why they just came in to dance.
Oh yeah, they came in to
That's
dance.
pretty
If they
good.
come for the free food, they have to pay for the food because we don't have that much money.
Because we didn't have any meal for them, but so to
Yeah.
Was
answer
that
that question
Matt?
about
I'm
tickets
sorry.
at the door. Yeah.
Yeah.
Alex, if the same thing happens this year to you that happened last year, let me know.
Thanks, Matt. I
Oh.
appreciate it.
We love that kind of thing. I had goosebumps last year about that. I'm just
Thank
telling
you
you,
for
that's
clearing
part of
that
my
up,
whole
Deb.
conference.
I don't know if that was.
Yeah, and Alex, you can on the the ticket form, you can order 10 tickets at a time, and you could do that many at once, and you're still gonna have to order all the food that everybody wants, like individually. You
Yeah.
order the food ahead of time. We got chicken, fish, and vegetables, 3 different ones. Yeah.
I got the vegan stuff last year.
Excellent. Me
Trying
too.
that.
The squash.
Trying that stuff.
No meat. I'm sorry.
The
We'll take that.
ravioli was so
Life
good.
It is.
changing.
It's really good. Yeah, yeah, yeah.
I think it was
We'll just have to-
butternut squash or something. I think
But
that's-
you know, it is the funnest event, and even the fact our DJ, like, she also happens to get services. She's there because she's a really good DJ. I mean, it's just a plus that she also happens to like be the face of somebody with a disability. But like, she played every song that anybody wanted. So, you know, it's just fun. There's a bar. It's not like if you have a disability, you don't have a bar. There's a bar there. There's music. There's good food. We have raffle prizes because we love raffle prizes.
Yeah.
We love a good raffle. Can I make
And
another
plan to stay till 10 because it doesn't end till 10. It's not one of those we go to bed at 8 o'clock things.
before we have to go? Can I make one more announcement? We did not put it in the slides because
Can we announce it?
yeah, I'm gonna announce it. I'm doing it. I'm doing it. Because when are we gonna get all these people here
Wait,
together?
let's have a
again?
drum,
So-
everybody. This is very exciting. It's taken us 10 years to do this.
So if some of you may or may not know that ANA has been working for many years on a documentary film called Best Judgment Lad School Lessons about the Lad School in Exeter and how it was shut down and what its history was and hope for the future. So it's excellent. I have to say, it's excellent. It's so good. We've had a few screenings already, but the big news is the same night as our conference day one, which it all happens at the same time. It is going to be on Rhode Island PBS at 8:00 p.m. on May 8th, Thursday, May 8th. So we are so beyond excited. And the people at Rhode Island PBS actually emailed us yesterday and said that they think that this will have a national audience. So very exciting. They are very excited to have it on PBS. So everybody mark your calendars the night of the Zoom part of the conference, May 8th, Thursday, May 8th at 8:00 p.m. Rhode Island PBS. So exciting. So
Very exciting. It was a lot of work, but it was worth it.
That's awesome.
Yeah.
It
So
is,
now
and
everybody can
I
have a chance to see it if you couldn't make it to the screenings that we've had. And
Wait, go ahead, Heather. Toot our horn, Heather. Do it.
Yes. I was just gonna say, I did make it to one of the screenings. It is amazing. I will say it definitely sits with you. There's a lot in there. But it's very important to see. I really, really believe that. I think for those of you who have not known the history of the DB system and everything that happened at LAD, I think it's such an important thing to watch, to see, to support. A lot of work went into it. Everybody involved in it. I mean, it really was amazing. It was amazing. And so kudos, congratulations, everything else to you because you deserve it.
Thank you.
And it's heavy, you guys. It's not like, I mean, it's really good, and but just be prepared too that it is heavy because what happened is
I
heavy.
say that it's great. It is amazing, but it is heavy, to Deb's point. I didn't want to be the one to say that, but it's heavy.
It definitely was amazing.
It was, Keith.
Especially with me coming from parents who actually physically worked at LAD school, but not that early in the years.
Yes, and Matt, that was you, not Keith. Sorry, but yes, it very, very, very informative. So there was a lot of information about how things in the system were, but things in the system a long time ago were not that great. at times. And so you definitely get to see how much progress has been made, which is a wonderful thing.
And you get to hear from people
Yes.
themselves who live there, who can talk about it. Because and so many of the people that are in it are not with us anymore. So so it's good that and we did do other interviews, and just future, so you know what to look for next is we plan to like archive all of those interviews, because people
Well, there is one
if you were
person-
interviewed and you aren't in there, we did not forget you.
There is one person that is still around that used to work there. One of my stepmother's friends, Teresa Lamphere.
Oh yeah, Teresa. We know Teresa. She's friends with Maggie, who's in the film. Yeah.
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 So isn't that exciting? And on that
That
note,
is
yeah.
very, very exciting. And I will say, I don't know if I should say this or not, but I'm going to anyway. I think in the current climate that of all things going on right now in I'll say in the world, this is a good good documentary for people to see, to know how we need to keep continuing to move forward and making consistent progress. We never ever want to go back.
Exactly.
That's actually, I kept
Yes.
saying that at all our meetings. I said this took a long time, but it will come out at the time that it's supposed to.
And
I
you
really-
are right, Michelle, because it definitely has.
Yep. And we don't have we're gonna release it on DVD at some point, but we don't have that there, and we don't have any more screenings, except we agreed to go to, where are we going?
Bridgewater.
Bridgewater State University. We agreed to go there way back when we thought nobody's gonna want to see this. So we're
I
doing
know,
that.
right?
But there
Yeah.
will be more screenings, but definitely not till after the conference. So you want to watch it on PBS. You really do.
I would like to make an announcement that April 7th, I don't know if you guys have been following Perspectives. Anybody that is involved with Perspectives, but on April 7th at 8 a.m. in the morning, I'm going to be on their podcast. It's called Noticeably Invisible. Just a little bio about myself and whatnot. So make sure you tune into that
So
YouTube
Matt,
podcast that
send
day.
us. So Matt, just email to me or to Keith some way that we can put that link on the page. Okay, like figure out
All right.
how, and we'll put that there.
All right.
That's really cool.
That's awesome.
Invisible is a YouTube page that the interviews are uploaded to afterwards as well.
Oh,
Okay, so send us that if you can, because
Yeah.
then we'll put the link. That would be awesome.
Yeah, I will.
All right, it's 4:31.
I just one more thing though, and the state can say this.
Okay.
I know we'll go, but what Matt just did, the state wants to hear from you guys. So this is a community forum. If you have stuff like Matt just said, the next one when, Heather? June?
Of course, you would ask me
June?
that.
I know. I don't know when it is. Is it June, Michelle?
I think it is in June. I just don't know
You
the
can register
date.
for it now on our website.
Maybe
But
the third week in June.
okay. Anyway, whenever
June
it is,
17.
if you have something you want to share like
Natalie.
that, tell the division, tell someone from A&A, we'll get it to the division. It's a community forum, and that was a perfect example, Matt. Thank you.
You're welcome.
This is a great bunch of people. Yay! Thanks for all being here, and we will see you in June 17th. And
You
we'll see
got
you
it.
on PBS.
Yes,
Thank
yes.
you.
Everybody tune in.
What's the
Thank-
name of it again?
Thank you, everyone.
Best Judgment Lad School Lessons.
Yeah, it's
Okay.
on
We're
Rhode
gonna-
Island
we're gonna put
PBS
it-
May 8th
We're
at 8
gonna blast
o'clock.
it on the website too. You'll
Make
hear
sure
more.
it gets in our newsletter too. Make sure that information gets in our newsletter as
Oh
well.
yeah,
too.
right.
Yeah.
Your newsletter. We're gonna put it in
Yeah.
a billboard on the highway. Everything.
Yeah.
We're gonna make little balloons. And, no. All right. And Andrew, our very own Andrew, is the narrator for the film, so that's
Yes.
another reason to go watch
He
it.
did a phenomenal
Awesome
job.
job.
He really did. Yes, he did a phenomenal. He did such a wonderful job.
I agree. Absolutely. A lot of familiar
Mhm.
faces on this film to enjoy.
Okay, thank
Contact the Division of Developmental Disabilities. Phone 401-462-3421. Para dejar un mensaje en español, 401-462-3014. Email bhddh.askdd@bhddh.ri.gov. You can watch this recording again and find out more about the topics that were discussed at www.advocatesinaction.org/DD Community Forums. Produced by Advocates in Action Rhode Island for the Rhode Island Division of Developmental Disabilities. Remember, nothing about us without us.